Cervix is the cylindrical portion of a woman's birth canal that links the uterus to the vagina. When there is abnormal proliferation observed in the cell lining in the cervix, mostly the cells on the surface of the cervix, then this condition leads to cervical cancer. Cervical cancer, according to WHO, is the fourth leading cause of cancer in women, and in 2018, approximately 5,70,000 women were diagnosed with cervical cancer, and 3,11,000 of them died. This grave condition in women can still be defeated by early screening and proper treatment. So today, we will tell you all about cervical cancer. Causes. Most cervical cancer cases are caused by the sexually transmitted human papillomavirus, or otherwise known as HPV. This is the same virus that causes genital warts. There are about 100 different strains of HPV, but only certain types cause cervical cancer. The two types that most commonly cause cancer are HPV 16 and HPV 18. Other common causes behind cervical cancer are long-term use of oral contraceptive pills, multiple sexual partners, engaging in sexual activities from an early age, smoking, different STIs such as gonorrhea, syphilis, chlamydiosis. If someone in your family has had cancer, if you have had some other cancer previously. Probability. The root of cervical cancer can either be genetic or some other issue with your body. Even though it is very hard to pinpoint on the most vital reason leading to the cancer, doctors have talked about some people who are the most vulnerable to cervical cancer. These can be people who have had 3 full-term pregnancies, people who regularly use oral birth control pills, people who conceived at a young age of 17 or less, people with poor diet, obesity, or a chronic addiction to smoking, people who have cervical cancer in their family history. You need to know that even if you fall under these categories that we just mentioned here, you don't need to panic. It does not mean you have cervical cancer, but you should definitely get yourself screened if you have the symptoms. Symptoms. Many women with cervical cancer don't realize that they have the disease early on because it usually doesn't cause symptoms until the late stages. And also remember, while other cancers like breast cancer and ovarian cancer mainly happen to older women, cervical cancer is the leading cause of cancer in women below 35. Now, the symptoms you should be looking out for are unusual bleeding, such as between periods, after sex, or after menopause. Vaginal discharge that looks or smells different than usual. Pain in the pelvis. Needing to urinate more often. Pain during urination. If you notice any of these symptoms, see your doctor for an exam. Stages. Cervical cancer has 4 stages. Stage 1. The cancer is small. It may have spread to the lymph nodes. It hasn't spread to any other parts of your body. Stage 2. The cancer is larger. It may have spread outside of the uterus and the cervix or the lymph nodes. It still hasn't reached other parts of your body. Stage 3. The cancer has spread to the lower parts of the vagina or pelvis. It may be blocking the ureters, the tube that carry urine from the kidneys to the bladder. It hasn't spread to the other parts of the body. Stage 4. The cancer may have spread outside of the pelvis to organs like your lungs, bones, or liver. Diagnosis. 2 popular methods of screening for cervical cancer are Pap smear and HPV testing. Pap smear testing is a common test that should be done regularly by all women. Post 30, you should go for pap smear testing every 3 to 5 years until you turn 65, and high risk HPV, HR-HPV test once every 5 years. If there are abnormalities noticed by the doctor, further testings like colonoscopy, biopsy, and conical biopsy (LLETZ), pelvic USG, and MRI can be prescribed. Treatment. The treatment pattern depends on the staging of cancer. There are over 85 to 90% chances of recovery if diagnosed in the stages 0 to 1. Post-stage 4, patients have anywhere around 16 to 20% chance of surviving for 5 years after diagnosis. The treatment options include surgery. It is a good option if cancer is contained in the cervix alone and has not yet become invasive. Often, hysterectomy is also suggested for patients by doctors. Radiation therapy. It helps in shrinking the size of the malignant tumor or to prevent the reoccurrence of cancerous cells post-surgery. Chemotherapy. It is used in advanced stages when surgery isn't an option. Sometimes chemotherapy is also given after surgery to eliminate any remaining risks of cancerous cells. The treatment plan is devised by doctors after proper diagnosis and staging. You must be aware that there are a lot of side effects to the treatment like infertility, fatigue, hair loss, diarrhea, nausea, bladder irritation, changes in menses, and early menopause. Prevention. There are ways to prevent this deadly disease from destroying your body, and they are very simple. Limit the number of partners you have sexual contact with, and use barriers like condoms while having intercourse. Cervical cancer is fatal, but if detected at an early stage, you can beat it with proper treatment and complete information. Wish you the best of health, and we hope you learned a lot from this video on cervical cancer. That's all from us today. We want you to know that your voice is important to us, so please leave a comment below. If you're new here, then click the bell icon for notifications of our new videos. For more content, visit our website www.thevoiceofwomen.com. Till the next time, stay safe and stay healthy, and let your voice be heard.